Good afternoon, everyone, and welcome to this week's National Bleeding Disorders Foundation, formerly National Hemophilia Foundation, Wednesday webinar. My name is Fiona Robinson, and I am the series host. In today's webinar, we will learn about 2024 funding opportunities presented by NBDF's Research Grants team. This webinar is being recorded and will be available to the community on the NBDF website shortly after the webinar. We encourage you to ask any questions you may have today. You can ask your question by using the Q&A feature at the bottom of your screen at any time during the webinar. We will monitor these questions, and following our speakers' presentations, we will put your questions to them. Today, we are joined by Samantha Carlson, Director of Research at the National Bleeding Disorders Foundation, and by Dr. Halli Benasutti, Director of Research Grants, also at NBDF. I'd like to thank Sam and Halli for joining us today, and I will turn things over to Sam now to get us started.
Wonderful. Thank you, Fiona. As we do with all of our talks here at NBDF, we're going to start with our mission statement. So Halli, if you could move us to the next slide. The National Bleeding Disorders Foundation is dedicated to finding cures for inheritable and blood disorder bleeding disorders to address and prevent the complications of these disorders through research, education, advocacy, and enabling people and families to thrive. And that's incredibly important as we look at research. Sometimes research can be detached from that, but it's really grounded in how we serve our community. So we'd like to go ahead and share some information about how we do that. So research impacts all of us. We are all patients, we are all caregivers, and research really broadens our understanding of healthcare, from what they see in the lab with the chemical and biological through mental health, physical health, wellness, etc. And that also impacts health, diversity, equity, and inclusion, and access to care. So we'll be talking about how we fund research in our community through NBDF and what those advances look like. Advances in science help us have shared decision-making conversations with our caregivers and our healthcare teams. So it's important to know all of our options so that we can further advance quality of life for people living with serious health conditions. As we go on to the next slide, I would spend an hour and a half to 2 hours on this, and I clearly can't, but I wanted to highlight what we are doing in the research department. We have a lot of different initiatives, and they do all intersect. So Community Voices in Research is our lived experience experts, patients and caregivers living with bleeding disorders, our registry. And we've had grant awardees through our grant system get the information and the data from CVR and incorporate that into their research to reflect that actual lived experience in research. Some of our awards
We seem to have a little bit of a technical problem with Samantha's feed. Just give us a moment here. We'll see if we can get her back live. Halli, is there anything that you would like to maybe either mention about this slide or something else as we just see if we can get Samantha back with us?
Yeah, I was just about to say I can take this over.
Sorry to jump in it.
Yeah, so the research department clearly has a lot going on. And like Sam said, we could spend a lot of time talking about this, but what's really important is that none of these things exist within silos of one another. So these different projects and these different elements of the research department at NBDF are all really intricately linked to one another. So for example, Community Voices in Research is a patient registry that's currently being disseminated throughout the community. And the information taken from CVR will be employed in the National Research Blueprint, for example. There's a lot of different elements of this. And so the point that Sam was, oh, she's here, so I'll let her make her point.
Well, for some reason I'm on generator power, but let's just go right up for it. So yes, the grants that we have do incorporate into all of the initiatives that we have across the spectrum of services that we provide for the community. We're happy to collaborate, and we can talk more about that should someone like to follow up with us later on. Was that where we left off? Okay, cool. If we could go to the next slide. So we would be remiss without saying thank you to this amazing, incredible community. For over 50 years, chapters have been helping us fundraise and advance science through research. And we cannot thank the chapters enough for that amazing work. All of your walks, all of the presentations, all of the incorporation into your programming, we so appreciate it. Your support for the Judith Graham Pooler, the JGP postdoctoral fellowship for over 50 years has been remarkable. We also have other partners such as Hemophilia of Georgia Endowment and the Dale Smith Research Endowment. And of course, our colleagues over at Sanofi, who have been generously funding the CDA, the Career Development Award, in 2023 and 2024, and hopefully beyond. So thank you for your support in helping us help researchers advance care in our community. If you go to the next slide, this shows you the evolution of the time frame of what we were talking about. So over 50 years of research, NBDF is committed to providing support and research in the community to advance care. And Halli will talk a little bit about that when we review the JGP in a little bit. But we have over 188 researchers we have funded in over 50 years, which is absolutely remarkable. The research department used to be in the medical education department at the very beginning, and then it established its own department external from medical education in about 2017. And then in 2022, we asked our amazing volunteers across the community of research in bleeding disorders to really help us look at what our grant program looks like, how we can evolve and continue to grow in opportunities in collaboration with other organizations like HTRS, as well as ASH, etc. And then I'm excited to tell you about our new platform, which I will in a few slides. Hal?
All right, so we want to get a little bit more specific here about the funding that NBDF, or the research that NBDF funding supports. So specifically, we're committed to advancing discoveries in inherited bleeding and blood disorders research, specifically stimulating breakthroughs and innovations. We like to invest in developing and advancing multidisciplinary healthcare providers and researchers and teams of multidisciplinary experts, which I'll talk more about in a minute. And then promoting person-centric research, including equity, diversity, and inclusion principles. So some examples of the research grants, or of the research that these grants support, include the biological mechanisms of inheritable bleeding and blood disorders and their related comorbidities, novel therapies, translational science, clinical advances, quality of care, and health equity, diversity, inclusion, and access to care. So the awards that we are offering in 2024 are the Judith Graham Poole Postdoctoral Research Fellowship, and I'll talk more about these in detail in just a second, the Career Development Award, and then 3 different Excellence Fellowships for nursing, physical therapy, and social work. So to start, we will talk about the Judith Graham Poole Postdoc Research Fellowship. This award has been funded since 1972 in honor of Judith Graham Poole, who is best known for her discovery of cryoprecipitation, which is a process for creating concentrated blood clotting factors, which significantly improved the quality of life for hemophiliacs at the time. So she's a really amazing woman in science, specifically in bleeding disorders research. And so this has been funded in her honor. It is funded by the chapters, so we thank them for that. It is $52,000 a year for 2 years. And again, this is specifically for early stage investigators in postdoc positions. The next award is the Career Development Award, and this is sponsored by Sanofi. This is for mid-level researchers, such as the assistant professor level and above. It's been awarded since 2000, and it is $70,000 a year for up to 3 years. And then finally, the Excellence Awards. So we award 3 of these, one for nursing, one for physical therapy, and one for social work. And these awards provide support for nursing, physical therapy, and social work-led research that are specifically tied to the bleeding disorders community. So being affiliated with the Hemophilia Treatment Center, and then These awards provide support for you to be able to conduct the research that you're interested in pursuing, which is, we prefer for it to be outcomes related data. So we seek applicants from any of these three disciplines, or from all three disciplines. We really encourage multidisciplinary teams to apply. And this award is for $15,000 for 12 to 18 months.
Awesome. Thank you, Halli. So we have a new process this year. So when you go to our website, and Fiona, if you could drop the link to our research website in the chat that I sent you, that'd be fabulous. On the submit your letter of intent button, it will now take you to what we call Proposal Central. So Proposal Central is a new platform that is helping us streamline the process of application for letters of intent, or LOI, and applications. So this is a database. If you go to the next slide, this is an organization that we decided, after looking at several, we wanted to streamline the process. Historically, we were using a Qualtrics, which is a survey mechanism, but we couldn't really take that data and figure out the impact. So what Proposal Central does, they have over 300 nonprofit organizations very similar to NBDF. So the American Cancer Society, the ALS, there's the Lung Foundation, there's a whole list of them that when you scroll through, you'll see. There's over 260 funding opportunities open right now in Proposal Central. So these are nonprofit advocacy, education, and research organizations very similar to NBDF that are really advancing care for people living with chronic and serious health conditions. So when you go to the website, you go from our website to their website, then you get to Proposal Central. You would make your profile. Here's the list of the information that you need for your profile. You can come and go on this page as much as you'd like. You can save it. We have decided to require an ORCID ID number for you for a variety of reasons. All the researchers that are in the audience right now probably know they have an ORCID, or they should have an ORCID number that follows you through your publications. So this helps us really step back and track the impact. So let's say with all the amazing applications we're going to get, we fund your research, and then we can start tracking how your research impacts other research throughout the community and throughout the country. We are giving Proposal Central some time, but they are putting the information that we historically have into the database, so we can generate reports and go back to the chapters and say, thank you, you made a huge difference in helping us advance this type of research over this period of time in this part of the country. And so that we really want to make sure that we give that information back to the community. You're giving us and trusting us with funding to help researchers, and we want to make sure that's reciprocated by giving you information about your impact. So once you enter all this information, if you go to the next slide, you will see at the top, there's the grant opportunities, and then you search for the National Bleeding Disorder Foundation. And this is what you'll see this year. These are the opportunities that we have. You click on them and it takes you right into the LOI process. It gives you all the dates where everything is due. And then this is the portal that we will use for communication with our peer reviewers as well as our applicants. Additionally, you'll see that little icon next to the Career Development Award sponsored by Sanofi. That is our policies and procedures. So it explains what the requirements are, but you can always also reach out to us as well. So if we go to the next slide, I believe I'm passing, oh, nope, just kidding. So here is the LOI portion. And you, again, save your information when you put it in, please. But you can come and go from this page as you're building out your profile and your LOI. So you'll need information from your mentor, you'll need information from your institution. So you can come and go in your login. I think Halli has our next section.
I do. Thanks, Sam. Here's an outline of our current timeline for this 2024 grant cycle that we are in. So the first thing that you'll do is you'll submit an LOI. Those are due by May 6th at 11:59 p.m. Eastern. Any LOIs submitted after that due date, we are unable to accept, so please be diligent about getting those in. LOIs are then reviewed by NBDF, and they are approved or denied based on eligibility criteria. And they will be approved or denied pretty quickly after they're submitted. So your application process, you should have close to a month. If you are approved and invited to apply by the deadline of June 3rd at 11:59 p.m. Eastern, You'll be notified of your approval or denial via Proposal Central. If you are denied application, you will be provided with constructive feedback. So that's definitely something that personally, as someone who applies for grants, it's really helpful when I can get constructive feedback. So a couple of things about the application and sort of the things that you're going to need to start thinking about and pulling together for this application. The first thing is a lot of demographics and information on the applicant as well as the sponsor mentor person, including education, training, background, commitment to a career in bleeding disorders, your hemophilia treatment center affiliation, any current pending or past funding that you've received, a letter of support from your institution, from your medical director, and from your mentor, and then administrative support from the financial and institution officer. So as you can see, it's a lot of moving pieces that you'll need to pull together for the application. So just make sure that you're on top of that. In the application, we ask that you include a project title, a summary, an abstract, references, an anticipated timeline, and a proposed budget for your project, as well as assurances and certification for research involving human subjects and vertebrate animals, such as IRB and IACUC documentation. We also ask for a biosketch in the NIH's format for both you and your sponsor or mentor. The Proposal Central website will take you to the biosketch outline so that you have that format. It's accessible on the NIH's page, but then you'll also have access to it through Proposal Central. And then finally, you will require a number of signature, or we will require a number of signature pages, including that you have reviewed the application guidelines, and this is a truthful submission of information. You will also need signatures from your mentor, your medical director, your institution, as well as your financial officer. So definitely, again, keep this in mind. As you're starting to put together your application, there are a few things to keep in mind regarding the process, the approach, and then just some other general suggestions that I have. The first of which is please read and adhere to the guidelines. This makes it a lot easier for our review. And then if you're not adhering to our requirements, then there's a good chance that your application will be denied. So just follow the formatting and you'll be good to go. I like to think about, or when you're proposing your project, ask questions from our perspective. We're the ones reviewing this, we're the ones funding it. And so if you're able to sort of put yourself in our shoes as you propose this project, it makes it easier for everybody to understand, and it makes sure we're all on the same page. And then again, give yourself ample time to gather all these required signatures. It's a lot of documentation in addition to the proposal for the project. So please make sure that you're aware of that and keeping that in mind. As you're filling out your application or writing your project proposal, please very clearly describe the specific aims and objectives of the project. Any deciphering that we have to do on our end tends to convolute things and can increase the chances of your application being denied. So specifically answering the questions, what is the impact of this project? What are the deliverables and measurable goals? And then how can you tell if this project succeeds? What sorts of methods of evaluation are you employing over the course of this project? And a couple other suggestions. Please have your mentors or the sponsor of this project and some other peers to review your project proposal pre-submission. The more eyes you can get on a draft, the better it usually turns out. And also please avoid jargon as much as possible. We do have experts reviewing these things, but sometimes they are not an expert in the particular project that you are applying with. And so it can be really helpful for our reviewers if you're using more plain language. Once you submit your application, NBDF employs a pretty rigorous scientific peer review process. So we get together a confidential panel of reviewers who will be selected based on their expertise, as well as how closely their expertise align with the focus of your proposal. And this panel will review the application. They'll critically review it and score it based off of the NIH criteria of significance, approach, innovation, investigator, and environment. So make sure that you're kind of hitting along those points throughout your application. And then reviewers will make suggestions to NBDF based off of how they have scored your application. And then the aggregated feedback will be provided to you. And then once this process is complete, NBDF will coordinate the contracting, payment, and the announcement of the award with the awardee.
Thank you, Halli. And I wanted to mention also that when you go into Proposal Central and you go to the LOI next to that little icon I showed you that has our policies and procedures, it's a 45-page document, I will tell you that. However, it is extremely helpful and it outlines that scoring criteria and the score sheets that we give the reviewers. So it's really important to take your time. That's page, I think I just looked it up, it's page 43 through 45. Very important to take the time to look at that when you're constructing your application. Okay, so monitoring and support. So you've gone through the process, you've been awarded, we got the contract through your institution and our institution, and we've cut the first check and sent it to you and said, go for it. So what happens now? So we're there with you all steps of the way throughout this process. We're there to support you, talk through some problem solving. We have awardees who call us and ask us questions all the time or kind of brainstorm some ideas or solutions. We're there to obviously monitor your progress. We do touch base every 6 months if we haven't heard from you. We do obviously want to adhere to our policies and procedures with both process, but also how the funding and the financial budget is going. But we're here for you. And we also do have a lot of conversations at conferences where we run into people we funded, but also opportunities to speak, whether it's at our Bleeding Disorder Conference, BBC, or the Research Journal Club through the Wednesday webinar series, et cetera. So lots of different ways to engage. If you post information on social media and you want us to help amplify it, we're happy to do that. We just really love to support and see the growth and development and advancement of research in our community. And then engaging in future resources. You know, a lot of our peer reviewers, a lot of the working group members of the National Research Blueprint and the State of the Science initiative that we had a couple years ago, all of those people are volunteers, and all of those people continue to come back and help us grow and develop these process and this programming. So we thank you for your volunteerism and coming back for more and possibly even more funding. So as we move forward to the next slide, I think we have an opportunity for you to have real-time updates. So if you go to our website, this is the screenshot of it, go to subscribe for email updates. You can select all of them, or you can just select research if you want, or maybe you want education information, that's fine, you can go there too. This is a wonderful opportunity for you to get real-time updates on when we open our grant cycles. It does change year to year based on funding and based on our internal processes. So you can keep going back to our website, or you can sign up for notifications, and that's definitely something you can do. Please do note that the first month you might want to check your spam box to make sure that it doesn't stay in there and that we can move forward from there and make sure you have the update. If we go to the next slide, please do take some time and look at our research website. We have funded by the foundation. It's on the left-hand side. You can go back and see all of the wonderful people who have been supported by NBDF research. You can read the plain language summary of what they've been working on. We do have our researchers send us information and updates on their publications, et cetera. So really take some time and peruse the wonderful work that's highlighted on that website. And if we move on to the next slide, this is our final one. So here is our contact information. We can open it for questions. The QR code should take you to our website as well. If you have issues with Proposal Central, we're still learning it too, but they are an amazing, amazing team. They've been very helpful. It's very user-friendly. Their support information is on the bottom, or Halli and I are happy to help you, and our information is on the top. Fiona?
Super. Thank you very much, Halli and Sam, for that really interesting presentation. There's lots of exciting opportunities there. It almost makes me want to go back to the bench so I can apply. Almost. Just before we start our live Q&A, I would like to invite our audience to check out the Zoom chat window. you should see a little chat icon at the bottom of your screen. And if you click on that, the chat should open up for you. And during Sam and Halli's presentation, we dropped 2 links into the chat. The first one takes you to the website for funding opportunities. The second one links to Proposal Central, which is the new LOI and application platform. These are great resources with a lot of information about the opportunities that Sam and Halli were talking about. So maybe take a second now to copy those links and save them somewhere so that you can go back to them once the webinar finishes. We also popped in a little note that has Sam's email address. If you want to ask something quite specific, you can reach out to her directly, and she and the team can support you that way. So just want to make sure that everybody is aware of those in the chat. And we did also put them into the comments on the LinkedIn Live, so they should be available to you there as well. So we will go ahead now with our live Q&A. If you have a question for Sam and Halli, please enter it in the Q&A feature at the bottom of your screen, and we'll do our best to answer all of your questions. I'll start with one that we received here. So this came in from an individual who said that they have developed the first small molecule oral therapy candidate for treatment of hemophilia, proven at University of Michigan in hemophilia A mouse model with a 94% drop in blood loss in those hemophilia mice. And they would like to present this to the community and ask for your input for funding.
Halli, what would you recommend?
I definitely recommend that you apply for some funding with us. If it works out with where you are at in your career as an investigator, and if that aligns with any of our current awards, congratulations. That's a huge success and a really amazing thing to hear. I'm super excited to learn more about it. So please feel free to reach out with more details too if you want to chat about that with us a little bit more. I'd love to learn more.
Additionally, there is the Hemostasis and Thrombosis Research Society, HTRS, does have funding as well. So a lot of times if we have someone who comes to us and they don't qualify for what we have open, we will share information with other organizations such as HTRS to the potential applicant saying, we don't have anything that you qualify for, but here are some resources we think in the community that you should pursue and give you the information. So please do reach out to us.
Great. Super. That's exciting. Another question is asking whether there are pre-doctoral fellowships for graduate students in PhD or PharmD programs.
In this cycle, no. The excellence fellowships are really something that we look at for multidisciplinary teams as well. So we've had nurses and social workers come together and put it in a joint application before, and I can give multiple examples, but I think it's really important to look at the multidisciplinary team at the treatment center and the clinic and say, how can we work together to potentially get some funding? So that could be an avenue to look at.
Great, super. Another question then, you did mention that you have funding that's available for early stage career, I think more in the sort of the bench research. What about somebody more in the healthcare professions? I know there are some excellence awards in nursing, physio, and social work, but what about people who are earlier in their careers in those areas and interested in research? Is there support there?
There isn't yet in our current model of grant funding. However, that was discussed during the National Research Blueprint Summit that we had in January, that really looking at what that workforce looks like across the entire spectrum of care. So that is being evaluated and looked at, and hopefully we'll have some updates on that soon.
Great. And I'm really into this collaborative research as well with the different healthcare professions, because my experience was always with pure bench research. So I just love the fact that you're encouraging much more applied research and collaborative research. Let's say you had a physio and a social worker who have an idea of something they'd like to apply to together. What program should they apply to? Because I see something for physio, I see something for social work. Like, how do you decide which one to send a collaborative application to?
Great question, and that came up last year, actually. So thank you for that. I think we need to update our policies and procedures to outline that. So they can apply under one or the other, and then they can have a conversation with us when that LOI comes through. That's not just to submit an LOI and we don't talk to you. That's a conversation we can have. And then we can also look at, if we do have more funding in one than the other, how can we spread that to make sure we're supporting as many researchers as possible?
Great, yeah. And what if I have an idea, but I just not even sure if it's like appropriate or relevant to what you're doing, or you would even consider it? Is there a way to have a sort of a pre-chat, a way to discuss it with
Absolutely.
you out? And
Absolutely.
We love
You know,
those.
yes, absolutely. Talking through it and looking at how to narrow that down. And Halli has an amazing way of, focusing that researcher to make sure that we're really setting them up for the potential to have an application that we can look at. So I think having the conversation is really important. Halli, I'd love to hear what you have to say, but we have had many pre-application conversations, and then the working groups are also an amazing resource as well. Halli?
Yeah, I definitely agree. I think that the more eyes and ears that get on a project before an application is submitted, as the project's being developed, I think the more inclusive and cohesive the project is. And I definitely think we love to hear about what you're working on, and we love to give some input as far as an application or connections or any sorts of contacts that we can provide. We're here to help you. That's why we're providing this funding. We wish we could give it to everybody. And yeah, I feel like starting that conversation is always a great place to kick it off.
that's really great, because applying for grants can be really stressful, and it can be really intimidating. And it's really, I think it's really a nice way to do it, a really encouraging way to do it, to think that the funders actually want to fund you. It doesn't always feel that way, right? Are there any specific grants that focus on epidemiological and global projects?
Not specifically at this point, but those are the grants that we have available right now will cover those. They are pretty broad in what we're inviting, so apply.
Right, so it falls within the topics that you yeah, okay, super. Well, maybe I can ask you, and I don't know, Sam, I think you've maybe been with the program a little bit longer. Can you tell us about any of the projects you've funded in the past that have been particularly impactful?
Well, how much time do we have left? I mean, I could talk the rest of the day about that. I really recommend that you go to our website and really peruse some of that research. It's remarkable. We were just at the THESNA conference last week, and two of our awardees, one current and one previous, presented. And it's just amazing to see the energy around the expansion of knowledge and research, especially in the bleeding disorders community. It's a tight, small, but mighty community, and it's still growing. So I really encourage you to look at our website under the Funded by Foundation tab under the research, and that link that Fiona has given.
Great, that sounds fantastic. You did mention, you listed the characteristics that you use when you're deciding, sort of evaluating an application. Did you want to take a moment to say a little more about them or highlight any of them? Because I think it was a significant list. I'm not sure if I caught all of them. Don't know if I'm putting you on the spot, sorry, but it's because it's always the question you want to know, right? When you send an application, it's like, well, what are they looking for? What's important? And sometimes terms are really clear what they mean, and sometimes, you wonder a little bit whether you're interpreting it the same way that the funder is.
Yeah, that was part of the point of me put yourself in our shoes, write this, answer these questions as if you're writing directly to, like, how are we going to read this and interpret this? I think that is a huge thing, is specifically thinking about NBDF's mission statement and looking at the past research that we've funded. That can be super helpful in kind of narrowing your focus. We do utilize the NIH criteria, and I recognize that they're 5 big things. But it's kind of broken down into different elements, where significance, approach, and innovation, to me, like, this is you selling your project, right? And then the investigator in the environment, are you selling yourself and your ability to complete this project? Because we have so many great ideas that are proposed to us, but we need to know that you can follow through on this idea and accomplish the goals that you have set out for yourself. So putting yourself in our shoes and thinking about, if I was evaluating this application from this organization's perspective, does my significance meet their ultimate goals, for example?
Right, makes sense. Is there anything you can suggest in terms of advice to make your application stand out?
Ooh, great question. Sam, do you have any?
We have a really rich website. I mean, there are so many resources. And if you look at our National Research Blueprint portion of the research website, it really outlines how we're trying to unite not only internally at NBDF, all of our collaboratives with the education and advocacy and health equity, diversity, and inclusion team, but also what we're doing in the community. So do your homework, spend some time perusing all that information on our website and really think through what your application is going to look like.
You mentioned a number of volunteers that work with you to determine and allocate the awards. Do you have any lived experience experts who are on your decision-making committees?
That is an excellent question. We actually we've had conversations about that. Halli, do you want to talk a little bit about what we're doing with the National Research Blueprint?
Yeah. So the National Research Blueprint is a huge research department initiative where we're trying to get lived experience experts or people that have direct experience living with a bleeding disorder, either by having one themselves or through a family member or being a caregiver for someone with a bleeding disorder. These people have a particular set of expertise, knowing what it's like to live day in and day out with a bleeding disorder. And so we want to include those expertise on all levels of research. And so we are trying to we call these people lived experience experts or LEEs. We're trying to get them involved in developing research protocols, leading research projects, evaluating the results of research and disseminating the information. And the conversations around getting LEEs involved in this has definitely, as Sam said earlier, all of these different projects are interconnected, including the NRB and our research grants. And the more that we can get LEEs involved, the better. They're the ones that this research is impacting. So having them in the evaluation of these applications and in choosing which research is funded is going to be huge.
So that's really exciting. So we could maybe even look forward to having sort of LEE co-PIs, having research that's, you've got sort of social work, physio, nurse awards. You could have something that's also a category with LEE applicants and research that's community-based participatory research, that sort of thing.
Yeah, that's the hope.
Super. I'm looking forward to that. We'll have to have another talk then.
Many talks, probably.
Yeah, I hope so. Well, that's the other thing too. Like we're looking forward to featuring some of your funding recipients on the Wednesday webinar so that we can also share the great research that they're doing. So
definitely.
So I think that wraps up the questions that we've gotten from our audience. Thank you very much, Sam and Halli, for answering those and all of my little personal questions as well.
Thank you for having us. We appreciate it.
It's fantastic. It's such an exciting thing to have, funding for research coming from this organization, centering really the LEEs, as you were saying. And so it's a great thing that we're really happy to showcase. Thank you very much for sharing your experience and your time with us this afternoon. I'd like to thank all of our audience members also for joining us. This recorded webinar will be available at hemophilia.org shortly after the webinar. If you go to the NBDF website under the Events tab and select Past Events, you'll find all of our archived webinars there. Also under the Events tab, you can see upcoming events, including the next Wednesday webinar. Join me next week, April 17th, World Hemophilia Day, for an exciting talk by Dr. Guy Young about treatment options for the hemophilia community. Thank you for joining us this afternoon and have an excellent week.